Wednesday. That means it's time for medical. And we're joined, as usual, by our resident GP, Dr.Vicki Schutte. Dr. Vicki, nice to have you with us once again.
Hello, thank you.
Right, last time out we were talking about fertility.
Yes.
And one of the things you raised was the effect of stress on fertility or infertility.
Yeah.
And I suggested that we do a show on stress. Let's go through this. What are the ABCs of stress?
Okay, so stress is basically a change that happens and your body's response to it. It normally causes strain, whether it's physical or mental. And you get good stress and bad stress.
What do you mean you get good stress?
You get good stress. So good stress is this. This is this is slightly stressful to sit here in front of a camera, and my body is now alert and motivated, and I'm ready to, to answer questions. So my brain's working faster. I hope. I can only hope. Bad stress, and it's short-lived. So bad stress would be when the stress goes on for a long period of time and when you don't have any relief or period of relaxation. So this is good stress. Bad stress would be, for example, you go through a divorce, your child gets sick, you lose your job. Those kind of things cause problems down the line.
They drag on.
They drag on.
And
Yeah.
on.
So you're in fight and flight all the time.
Yeah.
And that causes problems.
Now, how does stress, what sort of ways does stress manifest itself?
Okay, so as I said, so stress, healthy stress could be like you can just be more alert. Bad stress can cause health issues. So bad stress can eventually cause anxiety, depression, post-traumatic stress, but it can also cause physical issues. So you can get high blood pressure, you can get gut issues, you can get a lowered immune system, you can get illnesses due to stress. And if you don't address those, it can really impact your life and your health.
Can stress bring on diseases as sometimes fatal as cancer?
Absolutely. I think the body's response to stress, if you're in fight and flight, like I said, all the time, nothing works properly. Your cortisol levels go up, your hormone levels like serotonin, noradrenaline, dopamine levels are all demarcar. So your body can really take major strain and you can become ill. That's true.
Okay, let's not harbor on the negatives all the time, yeah?
Yeah.
How can we overcome that? How can we work through it?
Yeah, that's a good question. So obviously, the first thing during stress, one shouldn't just grab hold of pills. You don't want to just pop a pill to chill, a chill pill.
A chill pill.
Okay. So I think you should go through a series of things like exercise we know is good for you. Relaxation is good for you. So you can do walking, you can do tai chi, you can do yoga, you can do breathing exercises, you can do meditation, gardening even, painting, writing, all of those things. The other thing is it's very important to have a healthy diet through these stressful periods, okay?
Mm-hmm. Yep.
Have good enough sleep. That's very important. You don't want to add insomnia to that as well. And also, surround yourself with positive people or the people that make you calm and happy and support you and, share responsibilities, stuff like that. And also positive thinking, do some gratitude practice. Look at yourself or look at the day and see like, oh, I'm really grateful for this or that or whatever. Let me think. And then, so it's exercise and all of that. But then if you then realize, okay, these things aren't working, then, go and see your doctor or go and see a psychologist, maybe even a life coach. But it might be time to actually go and see your doctor once you've done all of these and you're still not
feeling, okay,
overwhelmed. Yeah.
Because I think in certain cases there is still that stigma almost of of people going even to a doctor. I'm not saying as far ahead as going to a psychologist or a psychiatrist, but even going to their own GP and turning around and saying, Dr. Vicki, I'm stressed.
Yeah, and I get that often. And it's important for your patients to know that they must go. You know, it doesn't mean we're going to put them straight on antidepressants and tranquilizers and sleeping pills. You know, there's natural remedies as well, or just a bit of counseling. I mean, it's hard to diagnose stress. There's no real...
you can't put a stress thermometer in their mouth.
It's the patient's perception, and you have to talk to a patient and realize where they are. It's a problem if you realize that they're suicidal maybe, or they've got OCD, or they get panic attacks. I mean, that's a real thing, and that really affects your life at home, at work, and one must treat that. And there is such a stigma to it. You know, patients always come, I'm so embarrassed to be here. I don't want you to think I'm loopy or cuckoo or pathetic, especially males, you know. It's not nice to go to a doctor as a man and say, I'm not coping, because men must cope. But it's not true.
Yeah.
Go to your doctor, discuss that, and then, you know, it's important for patients to know that these medications, if you talk about proper antidepressants and anti-anxiety medications, those medications that you go on for a long period of time, people think it's addictive. Most of those medications aren't addictive. They've got a few side effects maybe, but those side effects are transient. They should pass. Little things like a bit of nausea, maybe a bit of insomnia, yawning, clenching your teeth. But those drugs are not addictive. The treatment might last for 9 months to 2 years, but you wean onto them, you wean off them. You don't get dependent on them. And you know, everyone needs a bit of help sometimes. It's very, very common in my practice.
Yeah, I think there are, it doesn't necessarily mean that it's going to be a long-term thing, but every now and again, there are times in our lives, I think, where all of us need, for want of a better word, a crutch that we that we can just help us through.
So often patients also think, or my advice is, if your coping mechanisms is such, it leads to unhealthy behavior, basically. So say you start drinking more alcohol than normally, or you're taking painkillers when you don't even have pain, or you're now oversleeping, or you can't sleep at all, or you're now gambling, or compulsive shopping, funny things like that. You know, you must realize, okay, something's wrong. Or you get an eating disorder, you're not eating, or you're overeating, emotional eating. All of those things can point to anxiety, stress, and then come and talk to us or to someone.
I think that's the most important thing. It's just to talk to whoever it is, whether it's your partner or a close friend or your GP. Talk and don't stop talking. Dr. Vicki, nice talking to you.
Nice talking to you, Jim.
Dr. Vicki Schutte, thank you for joining us. If you like the show, press the like button. If you'd like to subscribe, press the subscribe button. And we'll catch you tomorrow for the travel show. Look forward to that one, as usual. Until then, bye-bye.